All right. Hi, everybody. Welcome to the virtual open house for the Center for Health Equity. My name is Mervyn Dino. I've got the privilege of co-facilitating this with my peer and friend, Donna. We'll introduce ourselves as well as the rest of the Student Advisory Subcommittee. And we're really honored to hold some space to share more about the Center for Health Equity. We're really grateful that members of the Center for Health Equity leadership team are joining us today. We know that interest in learning about centers and institutes and all the different resources available for DRPHers has been a need and really as a priority for all of us here. And we're happy to hold this space for those who are perhaps newer to the DRPH and those who've been in the program for some time. So I will hand it off to Donna. Before I do, Mervyn Dino, fourth year Health Equity and Social Justice concentration DRPH student. And greetings from Chicago. Hand off to Donna.
Thanks, Mervyn. Hi, everyone. Donna Castoblanco here, she, her, Aya. I'm also a fourth year DRPH student in the Health Equity and Social Justice track. I'll pass it to Blair.
Hi, everyone. My name is Blair Williams, and I have the honor and privilege to be in the same cohort as Donna and Mervyn, and same concentration as well. I see some other familiar names too, so it's good to see everyone. I'm also chair of the DRPH Student Advisory Subcommittee, so it's an honor and pleasure to be able to do this tonight, and it's just one of many that we have coming up. So stay tuned and keep an eye on your email for upcoming events. And with that, I'll pass it back over.
Okay, thanks so much. I know we're probably going to grow as the meeting continues, so feel free to introduce yourselves in the chat. And we're going to actually move to introduce our presenters for today. And forgive us, Dr. Cooper, Dr. Gumbe, and Christina, we're going to read your bios. We've truncated them a little bit, but we will introduce you as we're really grateful that you've joined us today. So first, very honored to welcome Dr. Cooper. Here, Dr. Cooper is the James Freese Professor of Medicine and the Bloomberg Distinguished Professor of Health Equity and Healthcare at the Johns Hopkins University School of Medicine, Nursing and Public Health. Dr. Cooper founded and directs the Center for Health Equity and the Johns Hopkins Urban Health Institute. A physician trained in internal medicine and a public health researcher, Dr. Cooper's work highlights the transformative role of doctor-patient relationships in reducing racial and ethnic health disparities. Dr. Cooper has authored more than 300 highly cited and influential peer-reviewed publications, including the book, Why Are Health Disparities Everyone's Problem? I've read it twice, highly recommend, and several book chapters, one of which was featured in the Institute of Medicine's 2003 report on equal treatment. 2021, President Biden appointed Dr. Cooper to the President's Council of Advisors on Science and Technology, where she advises policymakers and crucial scientific and technological developments. Dr. Cooper has been honored with numerous prestigious awards, including a MacArthur Genius Fellowship in 2007, and several other awards, and we'll also include a link to Dr. Cooper's bio as well. Last thing that we'll say is that as a respected member of the U.S. National Academy of Medicine, Dr. Cooper is recognized globally for her research on health disparities in racially and economically marginalized communities. Thank you, Dr. Cooper, for being here. All right.
Thank you for having me.
Thank you. And then next, we will introduce Dr. Bumi Agumbe. Dr. Agumbe is an assistant professor at the Johns Hopkins School of Nursing and Johns Hopkins Bloomberg School of Public Health. Dr. Agumbe is faculty at the Johns Hopkins Center for Health Equity and associate faculty at the Welch Center for Prevention, Epidemiology, and Clinical Research. Nationally recognized cardiovascular nurse scientist, her research focuses on improving cardiometabolic outcomes among populations who are most impacted. Dr. Agumbe leads multiple NIH and AHA-funded studies that integrate digital health technologies, community engagement, and implementation science to advance cardiovascular health equity. Dr. Agumbe's innovative work spans developing and testing culturally tailored interventions to improve hypertension control, implement novel approaches to advance diversity, cardiovascular clinical trials, and using advanced epidemiologic methods to identify multi-level determinants of cardiovascular inequities. Dr. Agumbe has several leadership roles, including the American Heart Association and Preventive Cardiovascular Nurses Association, and also has been recognized quite extensively as a fellow of the AHA and Preventive Cardiovascular Nurses Association. And lastly, I will share that she's a recipient, it's actually quite recently, of the 2024 Johns Hopkins Dr. Martin Luther King Jr. Award for Community Service. So Dr. Gumbe, I'm honored to have you here.
Thank you, and very kind introduction. Thank you.
Thank you so much. And our last introduction is Christina Vincent, who I just want to give a huge shout out for being so instrumental in bringing us all together today. Christina, thank you so much for being here. Christina serves as the Research Program Specialist at the Center for Health Equity, who runs training core operations for the center alongside Drs. Cooper and Agumbe. And again, very thankful to Christina for all her partnership on this.
Happy to do it. Thanks for having us. And thanks everyone for the interest.
All right, thank you so much. And with that, we will turn it over to the Center for Health Equity team.
Wonderful. Well, thank you all. Thank you, Mervin, Donna, Blair, all of you for inviting us and being interested in hearing about the Center for Health Equity. I'm Lisa Cooper, and on the cover of this presentation, this slide actually shows us, our Community Advisory Board meeting for, I think it was December of 2024 or 2023? 2024? Okay.
It was 2024.
Okay. So yeah, it was our meeting last year. And so we have a very active and enthusiastic community advisory board, as you can see. So we wanted to make sure we shared that photo with you. We welcome students to come and visit when we have our advisory board meetings as well. So we can move on. So we can give you just a general overview of the center and then try to answer some of your questions. So the center was established in 2010 with a grant from the NIH focused on addressing disparities in cardiovascular health. However, after the first 5 years, we've broadened our focus beyond cardiometabolic disorders. We also study cancer. We have researchers who do work in cancer. We have researchers who do work in populations that include children as well as birthing individuals. We do research across the lifespan. And we also do we use intergenerational approaches. Although most of our focus is on chronic disease prevention and treatment using community engaged and implementation science methods. So our mission is to promote equity in health and healthcare for every person, regardless of background or circumstances in the US and around the world. We have a 3-pronged approach that includes advancing scientific knowledge. That's all of our research, educating and training leaders like yourselves, and doing all of this in partnership with communities. That includes individual community members, family members of individuals who experience chronic illnesses, community-based organizations, healthcare systems, government agencies, businesses, a whole variety of different groups that we partner with in our various research studies. So next slide. So we're organized. These are our leaders. We have about 44 faculty, about 37 core staff, and currently about 75 trainees, even though we've trained more than 500 individuals here at Hopkins and more than 8,000 people around the world. As you can see, I'm the director. We have a deputy director who is Dr. Deidre Cruz, and operations director, Katie Dietz. We have our community advisory board co-chair, who is Reverend Deborah Hickman, who is a former director of a CBO here in Baltimore called STAR, Sisters Together in Reaching, which provided services to individuals with HIV/AIDS, and then also now with more chronic conditions. We have several associate directors. You see Dr. Bunmi Ogungbe, who is Associate Director of Education and Training. Dr. Yvonne Commodore Menza, who is Associate Director for Local and Global Innovation. We have Jessica Ye, Dr. Jessica Ye, who is Associate Director of Research Methods. And then Dr. Chidima Ibe, who is Associate Director for Community Engagement. So these are our leaders. And we can move on to the next slide. Oh, I just wanted to say our faculty come from across several schools, from schools of medicine, nursing, and public health primarily, with primary appointments in those schools. Many, and in fact, most of our faculty have more than one appointment, have dual appointments and joint appointments across schools. We're a very interdisciplinary group. And the way we do our work clearly is by, leveraging that interdisciplinary expertise. So we have people who are health professionals from a variety of different backgrounds, nurses, physicians, um, pharmacists, clinical psychologists, and then we have methodologists who span, all the way from epidemiology, biostatistics, health services research, outcomes research, organizational um, development research, health economics, et cetera. Okay, next slide. Okay, so first we'll talk a little bit about our research, our advancing scientific knowledge pillar. Next slide. So we have lots of different studies. Some of our past studies were focused specifically on hypertension. Some of them involved work within health systems. Others were more community-based. We've done a lot of studies that test community health worker interventions. Another strong focus of ours is on enhancing the food environment and also enhancing nutritional health of individuals with chronic illnesses such as diabetes, hypertension, chronic kidney disease. So we have done the first few studies you see on the upper left corner, 5+ Nuts and Beans, ACT study, and Project Red Chip were the first 3 studies we did in the first 5 years of the center. And then starting about 2015, we were funded to do a very large project called the Rich Life Project, which was funded by PCORI and NIH. And that was a very large study that involved 30 primary care clinics across 5 health systems, across 2 states, Maryland and Pennsylvania, and did a multi-level intervention that used community health workers and nurse care managers, and then also had an organizational intervention designed to train leaders in how to better manage health equity within their health systems, and also frontline staff in how to better address hypertension. So, and then we had our next sort of second wave of studies also included a trial called 5+ Nuts and Beans for Kidneys that expanded our original 5+ Nuts and Beans trial to basically test a nutritional coaching intervention in people with chronic kidney disease. We've done other studies in West Africa, for example. We had the Adinkra trial, which built on some of our learnings from the Rich Life Project and used a task shifting intervention that employed community health nurses and mobile health technology to improve self-management of hypertension and diabetes in patients in Ghana. We've done studies, like I said, of children in primary care, looking at using community health workers to help families that have children with chronic illnesses. Studies that look at how community health workers experience their work and what their needs are in terms of professional development. And our current studies are the Linked Hearts program, Unload Heart Failure, Healthy for Two, and Dash Life. There are 4 trials that have different approaches to addressing cardiometabolic health in different populations. So Linked Hearts uses mobile health technology, pharmacists and community health workers to enhance hypertension self-management in patients across several healthcare systems across Maryland and Washington, D.C. Unload Heart Failure is more focused on people with early stage heart failure, preclinical heart failure, using physical activity and self-management training to enhance cardiovascular outcomes in that population. And then Healthy for Two, which is looks at people with pregnant women and postpartum women with risk factors for adverse cardiometabolic health, such as obesity and prediabetes and hypertension. And then finally, Dash Life, which is another sort of food is medicine type study looking at dietary coaching following the DASH diet for individuals with diabetes and hypertension. So I think that's our broad portfolio. As I said, right now we are actively in the field with 4 trials, all community engaged. Next slide. And so those 4 trials are part of a grant that's called the Mid-Atlantic Center for Cardiometabolic Health, funded by the National Institute on Minority Health Disparities. And so what we're doing is testing the effectiveness of these various programs, informed by the best available research. So we're really looking at implementation science methods a lot, looking at processes of care, looking at reach, adoption of these interventions, along with sort of maintenance and sustainability beyond the initial interventions phase. And we're working with populations in rural areas as well as urban areas, and basically using CBPR and patient-centered outcomes approach principles. And then part of the work of doing this is also to make sure that we promote changes in practice and policy. So that's one of the reasons why we are working with such a large group of community stakeholders, all the way from sort of urban farm owners, the Y, for example, health systems, home visiting agencies for pregnant women, and then any FQHCs, a variety of different partners, and focusing a lot on planning for early dissemination and sustainability. Next slide. Okay, so I already told you about these 4 trials. So there you go. I kind of got ahead of myself. So the Healthy for Two, again, like I said, a health coaching intervention for pregnant women through postpartum, led by 2 faculty members, one with primary in nursing, Kelly Bauer, and then Wendy Bennett from School of Nursing. Unload Heart Failure is led by Chiadi Ndumele from the School of Medicine and myself, again, looking at cardiorespiratory fitness in individuals with diabetes and sort of early stage heart failure. And then Linked Hearts, which is co-led by Yvonne Commodore Menza in the School of Nursing, as well as Cheryl Dennison Himmelfarb, also in the School of Nursing. And then Dash Life, which is led by Dr. Deidre Cruz and Dr. Jessica Ye. So there's plenty of opportunities here for trainees who are interested in learning about recruitment, data collection, community engagement, data analysis, all of those types of experiences. Next slide. All right, I'm going to turn over to Bumi Ogunbe.
Thank you, Dr. Cooper. Laid the groundwork for what I'm about to talk about, really, how you can be part of some of the studies and be part of the various training initiatives that we have within the center. Next slide, please. And these photos are actual photos of some of our trainees. That's Shannon is on there. And maybe some of you may know her, but it's nice to sort of watch how people come through, and then they take some of the skills and the learnings and move forward with that. Next slide, please. And I do want to also acknowledge that I see a couple names that I recognize from our course. We'll talk about that later, but it's nice to see some of you here too. So in terms of our training, we're very intentional, and we do have specific training sessions or training aligned sessions that people can be part of. And as you can see, there's sort of a spectrum of engagement. If you're interested, you could, for instance, join our jam session, which is a monthly seminar. And we often try to bring in people who are health equity researchers or health equity research adjacent, do health equity adjacent work. And these are often people from all over. So all over the United States, different institutions. And I think we also try to bring in some global collaborators as well whenever we can. We also try to align the topics to be as timely and as germane as we can. So currently we understand what's going on in terms of public health policy, and we know those are things that people may want to engage with or hear about. So we've been doing more policy-focused jam sessions. And I personally like to share that this is probably one of the most interesting sessions you want to be part of, because we start with a little music and, we try to make sure everybody's okay. We make sure everybody's relaxed. It's not just another Zoom meeting, essentially. And there are opportunities for networking, for collaboration. And as Dr. Cooper was saying, if you want a bit more, so again, it's a spectrum. So you can start with just coming to the jam sessions and getting a monthly dose. But if you want just a little bit more, there are opportunities to be part of the studies that we have ongoing, some of them that you've just heard about. And as you know, in academia, it just never ends there. So we're going to have more future studies. We're going to have studies on various other topic areas, various subjects that may be of interest to you, if the ones we've just shared are not particularly your area. But there are a lot of opportunities to be part of these studies, whatever you want to learn. And we do everything from recruitment to you really want to learn how a trial is conducted, both in the clinics, but also in the community. We also do have some global health focused work as well. So we currently have, as Dr. Cooper shared, some studies in Ghana and Nigeria, the larger, more definitive Adinkra trial, like Adinkra 2.0, essentially, ongoing in Ghana right now. So we do have all of these different opportunities that you could be part of. We also have a newsletter that goes out, and it's focused on sharing resources, especially now, that people who do this work can engage with. And then the next one is faculty mentorship. So we do recognize that a lot of people may be new to public health research. A lot of people may have a lot of experience with public health practice, but the research may be a little new. So there's a lot of opportunity within our center to get that individualized one-on-one mentorship from our faculty. We have over 40 faculty members, various expertise. People may be interested in how to put together a research proposal, as an example, or people are interested in statistics and really want to learn and get those statistical skills. Whatever it may be, I'm sure we'll find someone within our center who is doing that work and be able to connect you. So that's another way, some of ways you could engage with us. And then we actually have coursework. And I sort of jumped ahead earlier by mentioning this. We do have some classes that we teach. Dr. Cooper and I actually teach a class. The one I said that I recognize some names on the call who have taken that class. So we teach the applications of innovative methods in health equity research. If you're interested in the frameworks, the models, of how to do this work, especially if you're at the point where you're thinking about your project or your caps, whatever it may be. I know there are different options, and you want to think about frameworks to use or even how to approach it. And the other thing we try to do is provide as much real life and real world examples. So we draw on a lot of the studies we just shared with you, and we try to present them to you in the class and offer opportunities for discussion. And then we have a local and global best practices in health equity research, and finally, foundations of health equity research. So if you're new to health equity research and you don't even know where to start, those are coursework that you could take. And finally, community engagement. The very first slide, you saw some of our CAB members, and that's really what we do. And I continue to learn a lot from Dr. Cooper and Reverend Hickman and all the wonderful people who have done community engagement meaningfully and very intentionally. So ensuring there's shared power and that we are able to sustain this. And the CAB has been ongoing for, Dr. Cooper, I'm going to 10 years, 15 years now?
15 years, yeah. Mm-hmm.
Yeah, so that really just tells you the extent of intentionality that goes into sustaining these relationships. It's not a one-off thing. It's not a helicopter engagement. We want to make sure that we continue to have the community be centered in the work that we do. Okay, so that was a lot we can share. I guess maybe we may be able to share this slide. We actually also do have a publication on this, but and we can talk more about this as well. We'll move on to the next slide. Thank you, Marvin. So our jump session, we've made it easier for you. We have a QR code right here that you can actually scan. And we actually just Still on the previous slide. It's okay. But if people want to take a minute or two to scan this QR code, this should take you to the registration site, and you could register for our next jam session. We just did this, the flyer you see on the screen. We had this wonderful presentations from these two amazing people. They talked about how they collaborate, just they give some specific examples on how we can do academic and government collaboration really nicely. And they gave some case studies from Baltimore City through their work. We do have the recordings as well. So you haven't missed out. If you have some time, you can watch the recordings. And then next month, we actually have one that is co-hosted jointly by with Bahi. I know some of you are Bahi fellows, so that will be of interest, and it's going to be focused on food and food insecurity and food is medicine in general. Dr. Cooper, if you wanted to add something, I saw you came off mute.
I was just going to say Hillary Seligman is going to be the speaker. She's from UCSF.
And I'm so excited about that. I just saw her talk last week as well. So she's an awesome. Yes, yeah, Hillary is amazing. Okay, so the next slide. Thanks, Marvin. So this is also this is actually our formal training intake form. Yes, this slide. And we also put a QR code as well to make it easier for you. So if you're interested in participating in our training program, as you've heard, we've been training different people and researchers and professionals. A lot of them are doing wonderful things across the world right now since 2010. And we've trained over 500 people. And that number continues to grow. And these are people at different stages of their careers. So if you're interested in this, please scan the QR code. It should take you to our intake survey. And then we try to reach out. We try to be really good with reaching out to everybody, ensuring that we can match you. For instance, if you're interested in one of our faculty members, we try to ensure that we match you with the correct person. These are some of our current and past trainees, including myself. And it's truly, personally, I will share, it's truly been an amazing experience, just having that network of wonderful people to work with, to reach out to, and to get that ongoing mentorship from them. So if you need more time, and thank you, Christina. Christina put the link in the chat box as well, so it's easy. So we can move on to the next slide. And these are the mentored research opportunities. We've already sort of talked a lot about this. There's an opportunity to receive one-on-one mentorship. There's an opportunity to participate in papers. If you're interested there's an opportunity to shadow, for instance, our community engagement activities if you're local. Well, we also try to do some things hybrid so that people who are not in Baltimore City can participate. We've got, everything from qualitative research methods to quantitative research methods, opportunities to learn how to actually conduct research using these methods, to implementation science. It's a wide spectrum. So we'll move on to the next slide. Thanks, Marvin. And we just wanted to show that we don't only train PhD students, because I know sometimes when we talk, things can sound very, academic and as though it's for people in academia only. No, we have DrPH students and trainees who have come through the center. So some of them are actually, I think a couple of them are on the call right now. Hi. So we're actually currently providing direct mentorship to some of you already. But if you're also interested, you could reach out to us. We'll try to find a good fit for you in a way that aligns with your current schedule, your current work, in a way that isn't burdensome to you. All right, and I think this may be, yes, we'll go to the next slide. Okay, and we just talked about this, and thank you for those in the chat box saying that the class was really nice. We're glad you enjoyed it. So as you've heard, testimonies, and we did not pay for these testimonies beforehand. So if you're interested in taking some of our classes, we do encourage you to. We actually have one specially designed for our Bahi Fellow. So if you're a Bahi Fellow, we actually have a seminar course that would be starting in the third term or fourth term. So we'll send more information about that to all BAHI fellows. But we encourage you to join our course, to consider our classes. And finally, we have some MOOCs. So we do recognize in the interest of equity in education and equity in actually health equity related education. Mervin, we can move to the next slide. We have some open source online course or MOOCs, massive open online courses that we've developed, and about over 8,000 learners have actually signed up and taken some of this. So if you know people who may be interested, or if you're interested, we try to ensure that there's no barrier to accessing a lot of these concepts because we know how important they are. And I think a lot of our learners are also from outside of the US, so we have a lot of global students who are in other countries taking this online courses. Next slide, please.
Dr. Gumbe, just letting you know, the slide is like going by itself. So if it,
oh, sorry,
I will pull back. No one's fault. It must be something weird in Zoom. So you see that it's not us rushing.
Yeah, it's not even moving.
Okay.
Oh, okay.
There we go. Is this?
Is it? Yeah, this is the next one. Is it working? Okay.
It should be. It should be.
Okay. And Carmen, I see your hand up. I don't know if that was intentional.
No, is this? Yeah, I can wait till you're done.
Yes.
It's a question.
Oh, we'll take questions in the end. And that's why I'm trying to move us along so we have time for questions. Yes, we'll have. Okay. And then we do have some pilots grants. So as part of the Match Center that Dr. Cooper talked about, we have an investigator development core, and this core is focused on training and supporting early career investigators. And part of that is also providing them with some pilot funding so they can get that preliminary data for additional grants that they may want to get. And these are our current fellows. I also got one of those in the last cycle, so I can attest to the kind of one-on-one mentorship that you can get from being part of this. So if you're interested, the next application cycle will be in 2026, and we can send you direct information about that once the applications are open. So that's another opportunity that that is available through the center. All right, next slide, if the slides are working. Okay, I will hand this back to Dr. Cooper.
And I'm going to zoom through this because I want to make sure we have time to talk with you guys. So again, these are just some slides that show some of our community engagement activities. So we can just move through to the next one. Yeah, I told you all about our community advisory board already, so I'm not going to say much more about it, but we definitely use it for bidirectional learning between faculty, trainees, and community members, and for building partnerships. And this is a photo from one of our, we had a strategic planning retreat at one point, and we took a picture there. So next slide. We meet on a quarterly basis. Again, the CAB is co-chaired by myself and Reverend Hickman, and it's really a forum for us to continue to be in dialogue about all of our work, our training programs, our research programs. We have breakout groups where community members can provide input into study design, into implementation issues, recruitment, retention, how to communicate the results, what's important in terms of advocating with local policymakers. They tell us about their work, what they're doing and what they need help with, and we try to respond and be helpful to them as well. Attend some of their events and provide sort of education and technical support to them and in their efforts to get funded and to do their work. Next slide. We work with policymakers as well. So this is just an example. One photo, we were involved in giving advice to the state of Maryland on the Maryland Health and Health Disparities Reduction Act that was 2010, I think, or 2012, something like that. So that's Governor Martin O'Malley at the signing of that bill, and I'm somewhere in there in the back. We give testimony on a number of different topics. This picture is from a testimony at the House of Representatives on funding for PCORI, because PCORI came up for funding renewal a few years ago. And so we share about, the benefits of the funding for us, our work in our communities. Next slide. The other ways we got involved in policy is there's some of these are listed here. We serve on national academies, committees. Like I said, we provide testimonies. We also help to inform small p policies. So policies around, for example, monitoring of health disparities and healthcare disparities within healthcare systems, how to do that, how to maybe potentially like incentivize health professionals to engage in health disparities work. We contribute to policy briefs and reports, and we serve on a lot of advisory groups and councils. And these are just some examples of some of the commentaries or reports we've contributed to in Maryland, and then also on a federal level as well. Next slide. Okay, so at the end of this, basically all of our efforts are in service of making sure that every person has the opportunity to attain their full health potential. And despite all the pushback that we are experiencing now, we continue to be steadfast in the work. And we're definitely working with others who are in this field to assure that the work and the progress that's being made doesn't get lost in the midst of all of the challenges we're facing. And so we're coming up with really creative strategies to continue our work and to attain funding from wherever we can. And yeah, just supporting one another through what seems like it's a challenging time, but actually we've been there before. And a lot of our community partners tell us it's been like this for them for years. So they are actually helping us to stay resilient at this time too. So we'll stop and take questions from all of you now.
Thank you so very, very much. And thank you to the students who have shared some questions in advance. A handful of questions have already been answered in the presentation. It seems like two might not have been, so I'm going to share those first, and then we'll pass it to the folks. You can type into the chat, or as Ted is doing, you can raise your hand and we'll pass it to you. The first question for the Center for Health Equity team: what collaborations do you have with the Disability Health Research Center?
Okay, so we actually, right now, I don't have a formal collaboration with them, but I do know Dr. Swenner very well. And, she has spoken at our jam session and worked with us initially early on when she was working to develop that center. So we're definitely aware of her. And if people come to us and express an interest in working on that topic area, we encourage them to reach out to her and work with her. But right now, we don't have a specific formal collaboration on a project that I'm aware of. Bunmi, do you know of a specific one?
No, not really. But she does have affiliation in the School of Nursing as well, and but I don't know of any formal one right now.
Yeah. We do, one of our faculty members does a lot of work in the area of serious mental illness, which definitely is a population that experiences significant disability. And so her name is Dr. Gail Dommett, and a lot of her work looks at people with major depressive disorder, anxiety disorder, schizophrenia, and looks at different models for improving the care of people living with those conditions. A lot of them are community-based settings as well. So if you're interested in that, in that particular population, we could link you up with her.
Great, thank you. And I know you've mentioned, Dr. Cooper, community-based advisory boards. There was a potential follow-up. How do you sustain funding for your programs, and how are community-based advisory boards and community partners compensated for their participation?
Yeah, so that's been a real challenge. Some of the grant funding we've gotten has specifically provided for that. Even our initial center grant provided funding to establish the community advisory board. So we've used that funding to support staff members who can make sure that that program is robust and that our communication with our partners is happens on a regular basis. They do get compensated for participating in all the meetings they attend and all the contributions they make. Oftentimes they will attend conferences with us and even represent the center at different programs. So most of our support for the Community Advisory Board has come from grants, either from NIH or from PCORI. But we do, sometimes there's been a funding gap where our grant didn't specifically have funding for the Community Advisory Board. A lot of that funding gap has definitely been sort of supported through some of my endowed chair funds and through some internal support from, like, for example, the Bloomberg American Health Initiative. But also, our CAB members have told us that it's not so much about money. They really enjoy just the camaraderie and being together with us, and they feel like they're contributing meaningfully. And so, even at times when grant funding wasn't that great, they just wanted to continue to meet anyway and to continue to be part of the program because they said they understand that they go through similar situations. But we always try to maintain some level of funding so that we can support them, their time, and then also just to offer them refreshments and things like that.
Great. Thank you so much. I'm going to pass it to Ted for our next question.
Hi, Dr. Cooper, Dr. Ogungbe, thank you so much, both of you. It's been a while since I've taken the class or one of the classes. Just first off to say that the final for the class, which was a health equity research plan or a concept, is still the core of my current dissertation proposal. So it stayed with me all these years, and it's gonna be with me for the next couple more years, I think. It's been such a challenging year, as you mentioned, Dr. Cooper. But our task is to stay focused, to be resilient, to be flexible, to sustain the equity gains that we've made and try and not lose ground. And I was really thinking last night, why am I going to join this seminar, this webinar, when it's, my time difference is monstrous. It's the middle of the night, and the answer for me is because I'm here to reconnect with my values, and to really just hear you, Dr. Cooper, Dr. Gumbin, Mervin, and the others who've been putting together this call. It's just been very nourishing for me. So thank you so much. And I can see in the chat, there's all these mini reunions happening in the chat. So it's not just me. And I think the camaraderie that you mentioned, Dr. Cooper, the vibe when you have a community advisory board. Of course, I've never been to one of them, but I can imagine it's just different. The vibe of a webinar like this is different from others. So thank you. And for others on the call, if you haven't taken any of the classes, take one. It doesn't matter which one. And because we're here doing this work, and we have to support one another. That's it. Thank you.
That is awesome. I tell you, I mean, I feel like we should take you around with us everywhere.
And I would say thank you, Ted. I remember your name and your father. You're one of those people that I was referencing earlier. And I know that whenever we did the live talk, it was very late for you. So thank you.
Other questions or comments from the group here?
Oh yeah, we definitely remember Ted.
That's awesome.
Well, we must have done an amazing job. Either that or everybody's like exhausted.
Well, I think if anyone's exhausted, Ted is joining in the middle of the night. So
I know.
we're appreciative to Ted, and I don't see, Don, I don't see any questions in the chat. I know
we saw some questions about LGBTQ populations and other things like that. You know, we are connected with faculty who are doing work in those different areas and with different populations, even if one of our studies right now isn't really doing that. If you reach out and that's what you're interested in, we'll make every effort we can to connect you with people who are working in the area that you're interested in. So, you know, just let us know.
Thank you. Blair.
Yeah, so I have a question and it's follow up on pretty much what you just said, but some other things is, you know, just giving that there's so many shifts and pivots in our work. Are you seeing different kinds of collaborations that are happening that maybe hadn't happened before? So multi-sector, corporate, what is that collaboration space looking like now during this time?
So I can say a few things, and then of course, Bumi, if you want to chime in, please do. I mean, I do feel like that there are some folks who weren't necessarily working in this space who have been more interested in learning about health disparities and maybe even working on it with us. In particular, in the last year, I've done a lot of talks to people who are employers and businesses that are interested in how they address this issue in their populations. Um, let's see, yesterday I was at a group meeting with a bunch of community-based organizations that do work in the area of land use. And, you know, surprisingly, so many of them wanted to connect their work to the health impacts because they felt like in order to get support for some of the work they do, one of the arguments that they could make is the important link between land use and health, you know, and housing, access and quality and all of that and affordability and health. And so those are groups that I'm sure they were doing work in this space forever and ever, but nobody had ever reached out to me about that before. So I think there are some new partnerships that are forming right now. Bumi, do you have
Yes.
anything you want to add?
Yes, absolutely. I think there are other kinds of partnerships which ordinarily we would think is a little unlikely, are with some of our colleagues who are in engineering and artificial intelligence, and they are more, they're doing those kinds of works. And they've been reaching out. We've also been reaching out to them because there's sort of this awareness that we probably should not continue to work in silos. There is a lot more that we benefit when we work together as a team, but also trying to inform their own work. So ensuring that whenever they're designing, for instance, I could share, I work with someone who does social robots. They actually build social robots that people can put in their house to help with behavioral change. And I was sharing things like, oh yeah, there's the health belief model. And they had never heard about any of those frameworks or models that we use. And they started to ask questions about, well, how about doing this in this population or that population? How would things be perceived? What would work? So those are some collaborations that were not very, we just sometimes did not think about in the past, but it's sort of emerging because now we know we all cannot rely on this agency or that agency or the other agency for funding, where we sort of have to work together. And the second one I would mention is the global collaborations as well is being strengthened. There is a recognition among our colleagues outside of the US that this is, an interesting time for us. And they've been reaching out and they are actually sort of now moving forward with this work. There's a lot of awareness of health disparities where they are. For instance, there's a group called, they're from the Royal College of Surgeons in Ireland, and they are talking a lot about, some of the disparities that is within the fabric of their own communities that they've not addressed. And sometimes I joke on the call, I'm like, it's so nice to be in the meeting and people can use the term health disparities comfortably and they can talk about equity comfortably, right? They can write it in their papers and in their grants and they're so excited about it. And they've talked about that part of why they're doing this or inspired to do is they're learning from the work that people like Dr. Cooper and other people in the US who have been doing this work for a long time.
I think you're right. We have a lot of interest from pharma as well. Yeah, a lot more people interested in the work despite the political climate.
And I would wonder too, just there's a lot of conversation around AI potentially having bias, and those models could continue and perpetuate negative narratives of the population. So I could see that there's a lot of collaboration opportunity there because the technical folks don't necessarily have that human-centered framework that we do.
Yes, absolutely. And sometimes I like to do the analogy of a lot of the health disparities that we are unveiling and trying to address now, could have been addressed, decades ago. If there was this openness to accountability and people just being interested in ensuring that everybody has equal access to high quality healthcare, high quality housing, whatever it may be. So it's nice that some of our engineering colleagues and AI experts are aware, and they are talking about this too, and they're trying to find what do we apply here? What framework? How do we look at this? How do we address this? Yeah.
Thank you, Blair. Thank you, Dr. Gumbe. Thank you, Dr. Cooper. I'll jump in with a question, and I work in health equity. I know many of our DrPH students, including Donna and Blair, also work in health equity. And the big elephant in the room is how do we keep going with this work? And we're at a time in which we're defending a lot of work. We're defending public health. We're defending health equity. And Dr. Cooper and Dr. Gumbe, I'm wondering from your perspectives, especially as you think about like DrPH students who really need to stay in the long game with this because this really is a long game. What words of encouragement, support would you offer to some of us who are really struggling to figure out how do we still build in a time in which we're trying to defend our work?
Well, this is really, really, really a challenging time, and a lot of what I've been doing recently is talking to younger people about this because one of the things I've been telling folks is just reminding them that it may not have looked exactly like this before, but we've had times in the past where like people were not that interested or supportive of this work. So this is not the first time this has happened. It's been here before. And I think a lot of what we have learned over the last several decades is that there are different ways of talking about these problems with different groups of people. And so I think this is a very good time to really practice some of that, like some of those relationship building skills, some of those communication skills where you really do a lot of listening to people and trying to figure out where they are and why they feel the way they feel or they think the way they think, and really trying to appeal to them in terms of like some need that they have that you might be able to help to address, right? So I think that that's something we need to keep in mind. And we do have a lot of people who are interested and motivated to do work in this space. So be open-minded about who it is you can connect with and you can partner with. And then there are also a lot of different career paths in this work. Clearly, many of us are interested in research, but I mean, there's always going to be a need for this work. It's just a matter of what people want to call it or whatever. So I think support for it ebbs and flows, but it's not going away. So I just try to remind people of that it's like I've been through quite a few seasons of this, maybe nothing such as explicit as where we are now, but I don't know. I feel like it's inevitable that whatever is going on right now is going to pass because the problem is really affecting like too many people and too many different groups of people. And it's only a matter of time before enough people realize that, there's something in it for them to figure out a way to work on this problem. So that's what I try to tell young folks. People who are younger than me,
Thank you. I definitely hear the spirit of don't quit. Health equity was needed yesterday, may have been called different something yesterday, but it's needed today and it's needed tomorrow. So certainly hear that. And thank you for those words. I think those words are consistently needed. And even us as a DrPH community need to lean into that.
I mean, I could not say racism or structural racism when I first started doing work. Are you kidding me? Like, I wouldn't have gotten funded or done anything, but I knew what I was talking about. I'm like, okay, so they don't want me to say that. I won't say it, but I'm gonna still describe what's going on and figure out a way to like work on it.
That's right. And a lot of the ways we communicate about it and how we navigate that context is so important too. So thank you for sharing that. I'm
And
looking
if
at our
it's
time. Oh, go
helpful,
ahead, Dr. Gumbe.
oh, I'm sorry. I just wanted to throw this in if it's helpful to anyone. So, for instance, if we cannot say health disparities, differences in health outcomes really basically means the same thing to an extent. Yeah. So those are some creative ways, even though it may not, it can be really hard, but we're still describing exactly what we're doing.
Would love to hear more about how you've adjusted your vocabulary around this. I was going to ask you that question, but you had addressed that. More recently, my work we've kind of have to relabel it because, the phrases like health equity have been demonized and they have been a barrier to getting funding and advancing the work. So more recently, I've called my work community engagement, community advancement. How have you shifted your vocabulary, and what other ways would you recommend to describe the work that we're doing?
Yeah, I mean, some of what you mentioned are things that I've done. I only shift my vocabulary if I'm asked explicitly to do so. I just have to say that. Because I feel like I don't need to be preemptively changing what I'm doing or saying. But if I'm specifically asked to change it, or or told that it's not going to be um, uh, supported or whatever, then I'll make the changes accordingly. But other than that, I continue to use the words that I feel like I know what the meaning of the word is. The other thing is I do a lot of just explaining to people what it is. And so it's saying it in plain English. So maybe the words we're so used to hearing them that we know what they mean, but other people just honestly don't even know what we're talking about. So we really have to explain it. It's complex, but it's like, gosh, people don't have opportunities to live in a safe place. They don't have enough food to eat. There's crime like where they live, and you just describe what the problem is, and I think people can relate to it when they know somebody who's gone through that, or they can't get in to see a doctor when they need one. People know other people who have experienced that, or they've experienced it themselves. And so you take away all the fancy terminology and just say it in plain English. That's what I would do. And also just ask people like what does it mean to you? Like when you hear that, what do you think? And then you can explain like, well, this is what I mean when I say that, you know?
Thank you, Dr. Cooper. And even connecting with people's emotions and what they experience in a daily life is so important. Lifting up Christina's chat here, advancing health equity by any name, and then how Blair has had to shift it as well. So thank you for these insights. I know we are at the end of the hour. We're so appreciative to the DrPH students who have joined at any point in their day. And of course, very appreciative to Dr. Cooper, Dr. Gumbe, and Christina for all your support and coordination. I'm very grateful to Blair as well for her leadership on the Student Advisory Subcommittee, and to Donna for your partnership. Donna, would you like to share anything as we close out?
Just thank you again, and sharing gratitude to everyone who has stayed on and who has hopped in. And thank you so much to the Center for Health Equity team.
You're welcome. Okay, stay strong, guys.
Before we hop off, let me go ahead and send our email and the email address. I saw Antoinette say she wants to stay in touch. When you email us at the Health Equity Training account, you'll likely get me who responds. So I'm happy to chat with you. Like, what is your email address?
Health Equity Training.
Training, yeah.
JHMI.edu, yeah. All right. Thank you
Thanks,
all.
everybody.
Thank you so much,
Bye.
everyone.
Have
Take
a
care.
great night.
Okay, bye.
Bye.